Coming up, we'll be on location at Sweet Smiles Dentistry in Falls Church, Virginia, discussing the latest advances in dentistry and how they can help you achieve that beautiful smile and improve your oral health with one of this area's top dentists, Dr. Ramineh Kangarloo. Welcome, Dr. Kangarloo. It's great to have you on the Top Doctors Interviews program again.
Thank you very much for having me here.
Oh, it's our pleasure. So today we're going to talk about oral health and wellness and how our dental health can affect our overall health. And can you tell us about how that is connected?
Oral health is actually part of a general health. There are a lot of systemic diseases that we see as signs and symptoms in oral cavity. And oral cavity at the same time can cause a lot of systemic diseases. The example I can give you is that the periodontal disease. Periodontal disease studies showed that can cause diabetes, heart problems, stroke, and even problems with pregnancies. At the same time, we see signs and symptoms of systemic diseases in the mouth. If a patient has acid reflux, or they have bulimia or anorexia, we see severe erosions of teeth. If there are different oral lesions, that could be due to lupus, or it could be due to even HIV. So these are connected, they are part of each other. Patients that they are on different type of medications, let's say patients that they are on diuretic medications, that can cause dry mouth or xerostomia. Or if they are on certain medications for seizure, it can cause the gingiva enlargement and bleeding. So we cannot separate them. I give you a very good example. A couple of years ago, a patient approached us with the complaint of a bleeding gum. His gum was severely bleeding. After I did the examination, because at that time I was practicing in the same location with the physician, so I asked the patient, have you had any blood work done? He said yes. A day or two ago. So I was able to get his blood work. We found out that he had liver failure. Making a long story short, it got to the point that patient lost his life. On the other hand, we had another patient that had a tooth extracted. Again, came to our office with a complaint of active bleeding. When I talked to the patient, I found out that he was our physician's patient and he was on dialysis. So unfortunately, the dentist kind of missed checking his blood work and finding out if it was a good time to get a tooth removed. That patient was bleeding more than 6-7 hours for a very long time. And when he approached us, he was pale. So it is very important for people to realize that the oral health and oral health is part of a general health. Nothing separates them.
That's a very important point and some great examples. Our oral health is so connected with our overall health, and if you don't take care of one, it can really affect the other. So that's why it's so important to have that approach where you really sit down with each patient and not only look at their teeth, but you want to find out about that patient, because it is about the overall patient that you care about.
Absolutely, yes.
And you do something really different here that a lot of other dental practices don't do. You have an approach that focuses on connecting the dental health with our overall health and wellness. Can you tell us more about your approach?
So when any patient walk into our practice, after they go, they get their paperwork and everything completed, and they're seen by our hygienist, the very first thing our hygienist would do is check their blood pressure. We want to make sure that their blood pressure is not too high or too low. There has been several cases that we actually refer the patient to the physician because of a high blood pressure, and the patient didn't know that they have high blood pressure. I have the opportunity to see the fact that how oral health is connected to the general health because my husband is a physician. And I have been practicing with him in the same office for around 10 years. And working basically with him, I was able to see that connection even better. So when I set up Sweet Smile Dentistry, I was able to bring that knowledge with me and help our patients better. We know what we do with our patients. We make sure that we have a good understanding of their medical conditions, of their medications. If there is any need for consultation with the physician, we will do that. And until that consultation is not clear, we don't treat our patients.
And Dr. Kangarloo, you have this great passion for your patients and for dentistry. Tell us a little bit about why you decided to go into dentistry.
So the dentistry is basically a combination of art and science. And I love that fact because I paint and I also do flower arrangements. So I can bring that art into the dentistry and create the smile that I wanted to create. And actually seeing that smile and making people happy and giving them a better self-esteem, it actually makes me happy.
Well, that's wonderful, and you're doing great work. Keep up the great work that you're doing, Dr. Kangarloo. And on that note, I want to thank you so much again for joining us. Very informative interview, very important about connecting health, overall health, and dental health together and how they can work together to improve our overall health. So thank you so much for being a guest today.
Thank you very much for having me.